So, a very good afternoon to everyone present here. Myself, Dr. Naresh Rangra. Welcome you all in this ISFCP sponsored dialogue series. Today's guest speaker is Dr. Lakhveer Singh, who is working as assistant professor in pharmacology department at Faculty of Pharmacy, DIT University, Dehradun. He is an alumnus of Kurukshetra University and he obtained his PhD degree from Baba Sahib Bhimrao Ambedkar Central University, Lucknow. His research areas are cancer, hypoxia, and immunology. With this, I welcome you, sir, in this talk, role of hypoxia-induced lactate acidosis in metastatic transformation of cancer. Over to you, sir.
Thank you, Dr. Naresh. First of all, before starting this session, I am very thankful to the chairman, Shri Dr. Praveen Gar, Director cum Principal Dr. G.D. Gupta, Vice Principal Dr. R.K. Narayan, ISF College Moga, for giving me this opportunity to share my views on metastatic transformation of cancer due to hypoxia-induced lactate acidosis. Uh, Dr. Naresh, shall I start?
Yes, sir. Yes, sir. Please proceed.
Okay. So, first of all, this is very common problem observed. Hypoxia is a very common problem observed in the solid tumors. So, in this session, we will basically learn that what is hypoxia and how it results in lactate acidosis and how does it help in metastatic transmission of cancers. So I'm starting, before starting the session, we will have a look on the content of this slide. The content in this course section, we will discuss on what is solid tumors, general mechanism of metastasis, and microscopic view of cells in solid tumor, introduction to hypoxia and its role in metastatic transformation of solid tumors, and why HF and alpha shift the metabolism of glucose through glycolysis only, importance of lactate acidosis tumor microenvironment, and so on. So, first of all, what is solid tumors? Solid tumors, as we know, in cancer, what happens? Cancer is produced in any part of the body when abnormal cells grows in an abnormal way and produce a mass or a tumor. Solid tumors usually are different from liquid tumors, which contain liquids like cysts or but solid tumors contain hardest tissue. They do not contain any cyst or liquid as ovarian cyst you have heard about. Solid tumors generally develop in the epithelial tissues and they can be classified into benign and malignant tumors. Benign tumors are generally localized tumors and these are non-cancerous, while malignant tumors are very dangerous and they can be life-threatening if left untreated. Uh, Solid tumors are further categorized into three categories. First is carcinoma, second is sarcoma, and melanoma. Carcinoma begins basically in the epithelial tissue, such as in the skin, or the tissues that composes internal organs like lungs and colon. Sarcoma begins in the connective tissue such as cartilage, fat, muscle, and blood vessels. Melanoma cancers that arise in the cells responsible for the pigmentation of the skin. So these are the basic three types of solid tumors. Now, what is metastasis? Metastasis means generally it is the process of movement of cancer cells, detachment from its site of origin, and then circulation in the body, and then dissemination to the different parts of the body, and then invasiveness into the target tissues, target organs. Like they can metastasize to bones, they can metastasize to brain, liver, and other parts of the body. Basic stages of cancer are basic, also depend on these stages of cancer, means from where it originated and where it has transferred. So on the basis of there are different stages. Primary tumor stages are that is, suppose a cancer is in the lungs, then it is spreading to the one nodule, second nodule. On the basis of the other stage, different stages are named. And if it has metastasized to for various organs like brain and lungs and liver and kidneys type of tissue, then it is also known as fourth stage cancer. And in the fourth stage cancer, it is very difficult to manage. We don't have any drugs or any treatment strategies. We don't have any treatment strategies to control to or to save the patient in the fourth stage. So we can just control, we can just save the patient if the patient is in the primary tumor stage. And primary tumor stage in the solid, if the primary tumors are just in the solid form, they can easily transform into a to gain a metastatic form. They are usually first means transfer to the nodules, means their tumor microenvironment is actually plays an important role in the metastatic transformation. So these are the different stages you can see in this diagram: invasive migration, then circulation, extravasation, dissemination to other parts of the body through the blood circulation, and then seeding into the perivascular site. Again, the cells in the in the tissue starts their formation of primary, secondary tumors. Secondary tumors are then are generally uh, then form, means any of the target tissue, they can start their proliferation, means cells in the target tissue at the target organ or a lungs, like, or the brain, they can start metastasis over there. So our purpose here is to how to stop the aggressive transformation of cancer. Means how to what are the stages at which we can, or what are the circumstances basically which forces the solid tumor cells to move from a primary tumor to secondary tumors, means into metastatic stage. So we will first have a look at the microscopic view of the tumor, solid tumors. Solid tumors generally uh, have different types of cells. In the if you have a microscopic view, you will find different types of cells. First type of cells which are lies near to the blood vessels. These are aerobic cells or normoxic cells. These are cancerous cells, but they are getting sufficient amount of nutrient or oxygen. So these are also known as aerobic cancerous cells or normoxic cancer cells. Second layer is composed of hypoxic cells. Hypoxic cells means they are not getting adequate amount of oxygen and nutrient. And then necrotic cells. Necrotic cells are actually dead cell. They do not divide, but still they have some role in the formation of tumor mass. Right now, from this diagram, if we look at the diagram of at this diagram, then it would talk about the problem of hypoxic tumor cell. There are three types of basically two types of dividing cells, that is aerobic cells and hypoxic cells. These two types of cells have their own problems. These two types of cells have their own problems, that these cells struggle for oxygen and nutrients, right? And they are generally most easily attacked by the or injured by the chemotherapeutic agents, and they can be attacked by the immune cells also, and they are also struggles for space, because there is a, if the tumor is continuously increasing in size, the cells which were initially localized to the blood vessels, they are constantly moves away from the blood vessels, and there is a one layer of cell keeps on pushing to the other layer of cells. So there is a constant of constant of space. Then fifth problem, there is pH in the tumor microenvironment is also observed very low as due to the Barberg effect. Now, introduction to hypoxia and its role in metastatic transformation of solid tumors. What is hypoxia? How does it help the cancer cells in the tumor microenvironment? So in solid tumors, as we have seen in the above diagram, that rapid growth and division generally observed in the tumor cells which were lies near to the blood vessels. So as the tumor size increases, it gains a reasonable size. The cells, some of the cells struggles for oxygen and nutrient availability. So those cells which are facing or which are struggling for nutrient and oxygen, they become hypoxics. And this condition is also known as hypoxia. Then now normal, what happens normally when a cancer cell does not get, when a normal cell does not get oxygen and nutrient, then it dies due to programmed cell death. But in case of hypoxic tumor cells, tumor cells or cancerous cells are immortal in nature. Cancer cell never dies. Cancer cell never die. So, hello.
Yes. So please continue.
Okay. So cancer cells never dies. They still keep on dividing. Now, question is, what helped them? What helped them to keep on dividing in oxygen deficient environment? So, for their survival, in absence of oxygen, when they do not get adequate amount of oxygen, these cancerous cells, uh, in these cancer cells, a cytoplasmic protein known as HIF1 alpha, hypoxia inducible factor 1 alpha. It is a cytoplasmic protein. This cytoplasmic protein help these cancer cells to adapt this or to sustain themselves in the hypoxic tumor microenvironment. Now, how does this HIF1 alpha protein? Hello, hello,
Please
sir.
continue.
Am I audible?
Yes. Continue, please.
Okay, sir. Thank you. So this HIF1 alpha works at the gene level in the hypoxic cancer cell to enhance their survival in the oxygen deficient environment. What this HIF1 alpha does? This HIF1 alpha form a complex with this another subunit, that is HIF1 beta, and this translocate to the nucleus and work at the gene level, activate various genes. These genes then directly and indirectly help in the participate in the metastatic transformation of the cancer cells. Now, at one point, we can also stop the progression of cancer at this stage also, because HF1 alpha is also regulated by PSD2. PSD2 in normal cells, this will be cleared by this slide. Suppose this is a hypoxic cancer cell. One side is hypoxic cancer cell, and another side we have a normoxic cancer cell. Here on this slide, we have divided, or we can assume that there are two cells. Like in normal cell, normoxia means normal cell. What is the role of HIF-1 alpha, HIF-1 alpha, and PSD2 in the normal cell? In normal cell, HIF-1 alpha hydroxylated by the PSD2 protein, and then it undergoes proteolytic degradation. This happens in every cell, every normal cells. But in case of hypoxia, suppose there is no oxygen, like a hypoxic cancer cell. If there is no oxygen, PhD2 become irresponsible, and in that case, HIF-1 alpha bind with another subunit, that is HIF-1 beta, which translocate to the nucleus. Once in the nucleus, it activates various genes, and gene product of, or protein product of these genes help in several ways to survive, help the hypoxic cancer cell survival in various ways. Like it enhances angiogenesis, enhances invasiveness, impart resistance, and it also work on upregulate the metabolism of glucose and fatty acid, and it also increases decreases the pH in the intracellular environment. Okay, what is the logic behind? Activation of glucose through glycolysis, and what is the major role of HIF-1 alpha? We can also understand that why HIF-1 alpha shift the or alter the metabolism of cancer cells, or how HIF-1 alpha alters the glucose metabolism in the cancer cells, so that they can they can survive even in the oxygen deficient environment. So as I told you, normal cells cannot survive without oxygen, but cancer cells are they are immortal. They can survive. HIF-1 alpha is helping them to adapt this adaptation. In this case, what HIF-1 alpha does, how means, if it is helping to the cancer cells in oxygen deficient environment, there must be a mechanism through which they can acquire energy. As we know, glycolysis a pathway which is a oxygen in which, for glucose, oxidation of glucose, there is no need of oxygen. For extraction of energy from glucose, actually we don't at this step a cell don't need oxygen, but to extract energy in the mitochondria, their need, or for the citric acid cycle, the cell needs oxygen. So due to in that case, HIF-1 alpha shift the metabolism of glucose in cancer cells through glycolysis only. So this is one adaptation in hypoxia, in the hypoxic cancer cell, brought about by the HIF-1 alpha. This is one adaptation, that is HIF-1 alpha guides the metabolism of glucose in the hypoxic cancer cell through glycolysis only, because in glycolysis there is no need of oxygen. But in oxidative phosphorylation, which take place in the mitochondria, there a cell need oxygen molecules to extract energy. But HIF-1 as hypoxic cancer cells don't have oxygen, so HIF-1 alpha shift their metabolism through glucose only. So those cells, that is hypoxic cancer cell, they are utilizing glucose only. They are dependent for their energy only on the glucose, and that is on glycolysis. They are getting only two molecules of ATP. Now, another Through this diagram, you can understand how hypoxia is enhancing the glycolysis. That is HIF-alpha. It upregulates the various genes of various enzymes of glycolytic pathway. Ultimately, glucose is oxidized to pyruvate. Here you can see the end product. Pyruvate is not entering into the mitochondria, but it is converted into lactic acid. Lactic acid is pumped out in the tumor microenvironment. Here, in the tumor microenvironment, it is responsible for decreasing the pH in the tumor microenvironment. That is, pH of the tumor in the tumor microenvironment reduces to 6.8. It has already reported in various studies. So this is one mechanism, one alteration in the metabolic pathway to enhance the survival of cancer cells, hypoxic cancer cells in the solid tumors. This is done by the hypoxia-inducible factor 1 alpha. Now, initially it was thought that lactic acid is because cancer cells cannot means they have solid hypoxic cancer cells have oxygen deficient, therefore these cells are synthesizing means carry on metabolizing glucose through glycolysis only. Therefore, they are dumping their lactate into the tumor microenvironment only. This was the reason told earlier, but now the reason was anything else. The reason will be clear in this slide, in this section. Why means various studies have reported that lactate is not a just metabolic product in the tumor microenvironment. It is more than just a metabolite. It it has various role that it can survive. It can directly and indirectly enhance the metastasis. So it is well known that solid tumor cells oxidize glucose mainly through glycolysis, and the end product of the cytoplasmic pathway is fermented into lactate, which is accumulated in tumor microenvironment. Initially, it was proclaimed that cancer cell cannot use lactate, therefore dump it into the tumor microenvironment, as which results in the decrease in the pH of the tumor milieu, as I told you. Now, uh, recent findings have explored the role of lactate acidosis in the tumor microenvironment. Cancer cells studies have reported that cancer cells utilize lactate in de novo fatty acid synthesis and to initiate angiogenesis, to enhance invasiveness, and it also has important role in suppression of immunity. Apart from this, lactate also helps normoxic in the development of metabolic symbiosis in the normoxic and hypoxic cancer cells. So there is some important cancer cells, uh, cancer in the tumor microenvironment. Lactate has a very important role for the cancer cells. So first is hypoxia-induced lactate acidosis promote fatty acid synthesis in solid tumors. In this section, we will means in the slide we will understand how lactate is enhancing fatty acid synthesis. So here is one is normoxic cancer cell. Here in the above diagram, you can see a microscopic view of the tumor. There is different layer of cell, that is necrotic cell, hypoxic cells, and then normoxic cells. These cells are normoxic cells because these are lies to the near to the blood vessels. So they are getting sufficient amount of glucose and nutrient. This is hypoxic cancer cells not getting. Since these cells are not getting oxygen, hypoxic cancer cells are not getting oxygen, they are totally dependent on glucose for their energy requirements. So glucose is metabolized by glycolysis in these cells, and end product pyruvate is converted into lactate. Lactate is then pumped out through the MCT4 receptor into the tube. some part of the lactate then enters into the normoxy cancer cells. What is the role of, or what is the importance, what is the need of lactate? Normally, initially it was thought that lactate is just a waste product, it cannot be utilized. But cancer cell has the potential to utilize it. Again, the lactate is then converted, enter into the normoxy cancer cell through MCT1 receptor, and it is converted back into the pyruvate. And since these are normoxic cells, they have oxygen, it can be utilized, it can be further oxidized into through the oxidative phosphorylation in the mitochondria. Apart from this, pyruvate is also converted into citrate, which is further converted into fatty acids. These fatty acids are or polyunsaturated fatty, converted into polyunsaturated fatty acids, and these are stored as triglycerides. Now, triglycerides as are required, since fatty acids are required in much more concentrations in rapidly dividing cells, because they need to synthesize their plasma membrane, they need to synthesize the cell organelles. So need of fatty acid synthesis is very high. At the same time, if these cells are to enhance the angiogenesis, again to support angiogenesis, they also need fatty acid synthesis. So this is the one mechanism how lactate is enhancing fatty acid synthesis in solid tumors or in solid hypoxic tumors. Again, there is a metabolic symbiosis for the utilization of fatty acids also. There is metabolic symbiosis for the utilization of fatty acids also. Means these cells, hypoxic cancer cell cannot synthesize complex fatty acids, because for synthesis of complex fatty acid synthesis, again, there is a requirement of oxygen. So these cannot synthesize. So some of the fatty acids are transferred to the normoxy cancer cells, where these are converted into complex polyunsaturated fatty acids and further utilized in the formation of plasma membrane and for other requirement. Fatty acids are also used in the beta oxidation in the mitochondria, because energy in the rapidly dividing cells, energy is required in a much higher concentration. Glucose glycolysis only cannot provide that amount of energy. Beta oxidation is actually further assist in the process of in the energy generation. Overall process eventually help in the enhanced growth and proliferation of the tumor cells. Here again, hypoxic cancer cell gets another mechanism for fatty acid. This is one mechanism how fatty acid lactate is helping in the fatty acid. Another mechanism is when lactate is continuously pumped out in the tumor microenvironment, there is decrease in the pH in the tumor microenvironment. Decrease in the pH in the tumor microenvironment also has influence on the endoplasmic protein SREBP. This SREBP protein, under the influence of reduced pH, becomes activated, and activated SREBP then enters to the nucleus, and where it activates the genes of FASN. FASN is a fatty acid synthase enzyme. So ultimately, SREBP increasing fatty acid synthesis, which is again stored as a small means just a long chain fatty acids only, and triglycerides and long chain fatty acids which are stored in the lipid droplets. This has been observed, this has been reported in various studies. In accumulation of lipid droplets has already been reported in various studies. So the purpose of accumulating these lipid drops has been reported that where is the basic need of that it would be used for future independency. These lipid droplets means this hypoxic cell today or tomorrow or after some time it will get access to the oxygen, and if when it get oxygen, in that time these fatty acids will help both in energy production as well as in rapid synthesis of their plasma membrane. So this is how lactate is helping to the cancer cells. So from this slide, we can understand lactate helps in fatty acid synthesis in two ways. First, lactate is taken up by the lactate from the hypoxic cancer cell is taken up by the normoxic cancer cell, where it is converted into citrate and then again converted into polyunsaturated fatty acids, PUFAs, which are stored as triglycerides as well. And fatty acids are also used in the beta oxidation. These fatty acids finally help in the rapid growth of these cells. Continuous pumping of lactate, another mechanism. Continuous pumping of lactate also stimulate these hypoxic cancer cells, means reduced pH around these hypoxic cancer cells, activate SREVP in this endoplasmic protein SREVP, then enters the nucleus where it activates the fasten gene, and ultimately it enhances the fatty acid synthesis and accumulation of lipid droplets. These lipid droplets are accumulated in the hypoxic cancer cells, will be used during the availability of oxygen in the future. Now this is the one role of fatty acids. So look at this. Solid tumors have three types of cells in the tube: normoxic cell, hypoxic cell, necrotic cells. Necrotic cancer cells do not divide but only increase the tumor mass. Hypoxic tumor cells are highly dependent on the glycolytic pathway for their ATP needs, because mitochondria triglyceride in the lipid droplets for future independence. Extra lactate is pumped out in the tumor microenvironment and develops a proton gradient across the plasma membrane of hypoxic cancer cell, which indirectly activates sterol regulatory element binding protein, which translocate to the nucleus and further increases the biosynthesis of fatty acids. So this is the mechanism how lactate is usually utilized by the normoxic and hypoxic cancer cell for synthesis of fatty acids. Another role of lactate also impart resistance to chemotherapy. Lactate also has important role in imparting resistance to the chemotherapeutic agents. How these solid tumor cells gain or acquire resistance to the chemotherapeutic agents? Look into this diagram. In this diagram, there is a normoxic cancer cell. Here you can see a drug sunitinib. It is a tyrosine kinase inhibitor. When this drug is given, another drug is cisplatin. Both of these drugs cause ultimately inhibit the act on the DNA synthesis. Ultimately, these drugs inhibit the replication or synthesis of DNA in the cancerous cells. Now, these two drugs actually are cytotoxic in nature, and they both have successfully inhibited the DNA replication or synthesis. But these drugs itself also has some role in the development of or in acquiring of resistance. Here you can see action of sunitinib through RTK or cisplatin generated ROS, which cause DNA damage. At the same time, you can also see the production of osteopontin. Osteopontin protein again has a role, means activate the synthesis of LDH, lactate dehydrogenase. This lactate dehydrogenase ultimately enhances the conversion of pyruvate into lactate, which is pumped out in the tumor microenvironment. Once in the tumor microenvironment, lactate enters the another cell, another cancer cell through the MCT1 receptor, where it act on the DNA. This is one mechanism, and lactate can also act on this foreign cell through GPR81 receptor. Through both these actions, through both of these actions, DNA of these cancerous cells, lactate has lactate has lactate has enhanced the upregulation of some genes, that is MRP and RTK. These mutated transporter, that is a receptor tyrosine kinase and multi-resistant protein 1. This is MRP is a efflux pump. So action of sunitinib and cisplatin, what has done? Increase the lactate in the tumor microenvironment. Lactate then entered into the another cancer cell. Once in the cancer cell, it acted on the DNA and enhanced the activation of or the synthesis of multi-resistant protein 1 and RTK. So these multi-resistant protein, what it does, whatever amount of cisplatin enters into this cell, whatever amount of cisplatin enters into this cancerous cell, it is immediately expelled outside. At the same time, this is a muted RTK. Here is tyrosine kinase inhibitor sunitinib binding on the RTK. It is a sensitive receptor tyrosine kinase, but receptor tyrosine kinase produce under the influence of lactate is a mutated one. It is resistance to the sunitinib. So this is how lactate is enhancing resistance to the cancerous cells. Another, apart from enhancing resistance, lactate acidosis also has some role in the angiogenesis. Now, what is angiogenesis? Angiogenesis means formation of new blood vessels. Because as the tumor size increases, those cells which have become hypoxic or those are not getting adequate of oxygen and nutrient, these cells also need oxygen and nutrient. It doesn't mean they are dying in absence of oxygen. They are hypoxic. HFN alpha is helping them, their survival. They are only dependent on glucose for their energy needs. But at the same time, they are also releasing some cytokines or some growth factors which directly or indirectly circulate through the interstitial fluid, bind on the nearby endothelial cells of nearby blood vessels, and where they initiate the process of angiogenesis, means formation of new blood vessels. Once the new blood vessel has started, slowly these hypoxic cancer cells start getting oxygen and nutrients. So this is also done by the lactate. Again, look at this diagram. Here is a hypoxic cancer cell. Now, in this diagram, we have also shown some other type of cancers. Means some immune cells also have some role in the enhancement of angiogenesis. So, how does lactate is enhancing angiogenesis? At the molecular level, we can see how it is acting on the endothelial cells. Look at this diagram. Here is hypoxic cancer cell, normoxic cancer cells, and these are endothelial cells. Now, hypoxic cancer cells are totally dependent on glucose. So they are synthesizing and secreting. They are metabolizing glucose through glycolysis, and lactate is pumped out through the MCT4 receptor. Lactate entered into secreted or pumped into tumor microenvironment is then directly act on the endothelial cells. Endothelial cells, this is the enlarged version of endothelial cells. Once it has acted on the endothelial cells, endothelial cells become stalk endothelial cells. Stalk endothelial cells. So on stalk endothelial cells, in the stalk endothelial cells, lactate enter through the MCT1 receptor. Once in the once it has taken entry into the stalk endothelial cells, it again activate various act on various genes like BGF, GAS6, ENG, IL8. These activation of these genes eventually result in the formation of some cytokines or growth hormones which binds on their respective transporters and eventually again act on some on the genes which help genes like cyclin D1 and MYC1. Once they have acted on or activated cyclin D1 MYC, these endothelial cell become start cell division. So this is how a new blood vessel or endothelial cell division take place. This is how lactate initiate cell division in the endothelial cells, or how does lactate initiate or promote angiogenesis in the solid tumor. So it has a very important role. Once at the same time, some of the endothelial cells also converted into tip endothelial cells. Tip endothelial cells have finger-like projections, or in these tip endothelial cells, lactate also enters. Entering of lactase enhance the sprouting of tip endothelial cells, and these tip endothelial cells makes their way through the stroma of the solid tumor. So ultimately, the continuous process eventually lead the formation of new blood vessels in the solid tumors. So this is how lactate is enhancing angiogenesis. Next is how lactate. I am not reading the slides means pathway directly. I'm just trying to explain it. If because just reading the slides it's not good, so I am trying to explain the whole process just by through the slides. Now this is how lactate enhance invasiveness. What is invasiveness? Invasiveness means slowly tumor cell achieve a behavior to pierce or enter or invade into the adjacent organ. Suppose there is a tumor in the liver. The liver tumor can enter or invade into the colon or into the lungs, or if there is a tumor, in the duodenum area, it can also enter into the it can invade into the liver also. So what is how lactate is helping in the invasive process? So there is simple process. We have also explored, various studies have also explored this, how lactate is enhancing invasiveness. So here in this diagram, you can see there is continuous secretion of H positive ion. These H positive ions and lactates are basically due to the lactate ions, and lactate accumulated in the tumor microenvironment, as I've told earlier in the slides, has some influence on the cancer cell. So it activates various genes. One of the gene is TGF beta. TGF beta, once activated in the lactate acidosis, has receptors, means it acts in the autocrine way and act through this MED pathway, eventually activate ZEV1, CDS2, cadapsin, bimentin type of genes. These CDH2 and bimentin genes, these are basically form a link with adjacent tumor cells as well as with the basement membrane. So if a cell is to migrate from its site of origin or from its or a cancer cell is to detach from its tumor site, then it needs to break its contacts from the stromal tissue. So first of these CDH2 and bimentin, these both type of proteins have means they are responsible for forming linkage. Linkage. These CDH2 and bimentin proteins form a linkage between the adjacent tumor cells along with the basement membrane. So once these proteins are formed or formation is inhibited, eventually it helps in the epithelial to mesenchymal transition, and ultimately it also helps in the invasion process. Invasion process is more clearly shown here. uh, this is tumor blood vessel cells. This is hypoxic cancer cells secreting more and more lactate. Lactate is also enhancing TGF-beta and other proteins like MPP, human growth factor, FGF, MPP, matrix metalloprotein. This is also a digesting enzyme. The role of this enzyme is to break down the stromal tissue. Once the stromal tissue is degraded, a tumor cell can easily get away and can enter into the blood vessel. And once it has taken entry into the blood vessel, it is disseminated throughout the body. Now, once it is in the blood, from the blood it again reaches to the target tissue. Once in the target tissue, again it takes entry through the blood vessels, through the endothelial cells, and once has reached to the lungs or to the liver or the brain or the kidney. Once there, they start their colonization and eventually form secondary tumors. So this is the basic mechanism of metastasis initiated through invasions by the lactate. Apart from invasiveness, apart from metastasis, invasiveness, lactate also has some role in the suppression of the immunity. What it has been reported by various studies that lactate acidosis in the tumor microenvironment suppresses the macrophages and dendritic cells, T regulatory cells, and cytotoxic T cells. Because immune cells has the function to uh, to identify and kill the cancerous cells. But it has been observed that in the tumor microenvironment, which is rich in lactate, in this lactate environment, these all types of immune cells fails to execute their action. Take example of macrophage. These are it is antigen presenting cell. Dendritic cell, it is also antigen presenting cell. So in these cells, macrophage, lactate when enters, various enzymes like BGF, AMG, and RTNLA genes are activated. These genes products are ultimately act as an anti-inflammatory. Means this is the one reason. Means in the solid tumors there is no inflammation actually occurs, and sometimes there is no pain felt sometimes in the solid tumors because lactate in the tumor microenvironment forces the macrophages to produce BGF, ANG, and retail genes. Those have anti-inflammatory effects. So this is one mechanism. Another, in dendritic cell, it has also been seen that lactate enters into dendritic cell and suppresses the antigen presentation by these cells. Antigen presentation by these cells is suppressed, and there are some cytotoxic T cells. Cytotoxic T cells acquire sameness type of behavior in the presence of lactate acidosis. And T regulatory cells also inhibit their formation, proliferation, and specific function. This has been observed in the process of in the presence of lactate in the tumor microenvironment. So overall, I want to conclude my whole discussion on this topic that hypoxia has important role in the metastatic progression of the cancer. It enhances lactate acidosis. Hypoxic cancer cells metabolize glucose through glycolysis only, which increases lactate in the tumor microenvironment. Lactate then impart resistance to chemotherapy. It suppresses support angiogenesis. It also support invasiveness and it support immune system also. Along with this, it enhances nucleotide biosynthesis, enhances fatty acid synthesis also. So lactate is a major metabolite which is actually help in the metastatic transformation of cancer. Inhibition of lactate in the tumor microenvironment through inhibition in the tumor microenvironment can prevent the metastatic progression of the cancer. There are so many people who have some tumors in their body, in lung tumor, and they are still not metastatic, but they can convert, they can acquire a metastatic behavior if they are not treated on if appropriate action is not taken on time. So one mechanism to stop their metastatic transformation is to prevent the lactate circulation. So physician must focus on circulation of lactate in the tumor microenvironment. They should focus on the synthesis of formation of lactate in the tumor microenvironment. They should check the acidity in the tumor microenvironment. So by doing this, or by just stopping the production of lactate in the tumor microenvironment, they would be successful in preventing the metastatic transformation of that solid tumors. So this is one approaches. Apart from this, they here I have also concluded some points like how we can stop the lactate circulation in the tumor microenvironment. So one is inhibition of MCT1 and MCT4 receptor. This is one mechanism through which we can prevent the lactate circulation in the, we can stop the lactate circulation in the tumor microenvironment. And we can also design some drugs which can specifically target the hypoxic cancer cell. Chemotherapeutic agents have also been observed that they are not acting on the solid hypoxic cancer cell because chemotherapeutic agents require good supply of oxygen. So they act only on the rapidly dividing cancer cells, but they fail to act on the hypoxic cancer cells because there is the deficiency of oxygen and there is acidity of that part is also very low. So in that part, some of the drugs fails to activate. So one way to deal with this problem is to design some drugs through nanotechnology. One technology, I think, through which we can design some nanoparticles which can target to the tumor microenvironment where pH is low and where they can show their chemotherapeutic effect. Another most important target is LDH inhibitors. Currently, various LDH inhibitors are already in clinical trials. In the future, various drugs will be available for those will be acting. Those will be acting on the LDH inhibitors, LDH enzyme, and MCT receptors. So, with these words, I want to say that metastasis of ovarian cancer can be prevented by just stopping the lactate circulation in the tumor microenvironment. So this is the literature that I followed. These are my papers that I have published, and thank you.
Thank you, sir, for this beautifully explaining this topic. So, on behalf of IQAC-ISFCP cell, I extend a really hearty vote of thanks to you, sir, who spared uh, his time from the busy schedule to grace this occasion. Today we had an opportunity to hear your thoughts on the topic, that is role of hypoxia-induced lactate acidosis in metastatic transformation of cancer. And this will surely be going to encourage us in our future research events.
Thank
Thank you,
you.
sir.
Anyone has question related to this? Related to this?
Sure, sir. Actually, this is already streaming on the YouTube, sir, so they can directly contact me.
Okay. So thank you, Dr. Naresh, and I am very thankful again to the uh, chairman sir, myself, Police Moga, and director sir, and all the management and all the team members who, all the participants in the seminar. And thank you very much.
Thank you.
Should I disconnect?
Yes, sir. Yes.